And a couple of topics that we wanted to bring up was an HMO versus a PPO. I don't run into HMO plans very often, but I think that it's worth taking the time to mention that an HMO, you're going to have a more limited network. So everything in an HMO you do have to declare a primary care physician, and everything needs to run through that primary care physician for referrals. With a PPO, you do not have to have a referral to go see a doctor or a specialist. You're still dealing with network, so you still need to stay within your network in order to receive the most discounted pricing, but you don't have to ask someone's permission to go to a specialist or to go see this dermatologist or somebody that you are wanting to see. I wanted to make note of that before we got off onto another topic.
Yes, good point. So HMO it's managed care. I mean,
yes.
it's totally managed care, and if it is out of network, they're not going to pay a dime. So, and you really have to be careful with HMOs whenever you're traveling or you're out of state, or, if something were to happen. And I am not saying that won't cover you, but you need to be on the phone or have your significant other on the phone, communicating the fact that you've been in a car accident in Texas and you're going to such and such hospital, so you can work all that out. But a PPO would give you the ability to, they have in-network and out-of-network benefits. So they're not going to just say, we're not going to pay it. They may go from 80-20, like when we talked about coinsurance, to 70-30, but they'll at least let you go see another doctor that's not necessarily preferred.
Yes. Disclaimer. Subjects that we discuss on the podcast are meant to be used as topics of conversation. All figures given are sheer examples. All information is subject to change and probably has changed since the airing of this podcast. Rates and figures change depending upon the demographic in which you live. Anything discussed in this podcast is our opinion. We do not represent Medicare, any governmental agencies, or any of the carrier partners on this show. Each person should do their own research on the various websites to ensure accuracy.